With climate change, the importance of intact ecosystems seems more apparent than ever before. Humans all around the world rely on a healthy relationship with nature around them and will continue to do so in the future. To describe these relationships between nature and humans, we often use the concept of ecosystems. As an ecosystem, we define a geographic area where plants, animals, and landscapes work together to form a small bubble of life. A complex system that is often above today's understanding. These fragile networks are notoriously hard to study and rely on a perfect natural balance. Even the smallest change to the system can have devastating results on all its inhabitants. The emerging concepts of eco-health, One Health, and planetary health all focus on the relationship between the health of ecosystems and human well-being. They're the study of the direct and indirect links between nature and human health. There are many indicators of the health of an ecosystem. One of the most important variables is biodiversity. Biodiversity describes a variety of life in a certain location. It depends mainly on the health of local plants and wildlife. Poor habitat quality, lack of natural resources, and the existence of contaminants threaten the well-being of these populations. The loss of a species in such a system can have rippling effects through the networks, which affect all of its inhabitants, including humans. In tropical ecosystems, amphibians pose a key group. Their activity affects ecosystem structure as well as ecosystem functions such as decomposition and nutrient cycling. Their place in the food web also controls certain species of insects and birds. As we'll see, these ecosystem functions can directly affect human health. In 2022, a new paper got published, highlighting a unique interaction between wildlife and human health. It was written by Springborn et al. And deals with amphibians and malaria. Malaria is one of the biggest current threats to human health. It is a mosquito-borne disease and mainly exists in tropical countries in Latin America, Africa, and Southern Asia. It still causes huge death tolls each year. In 2020 alone, an estimated 241 million people got infected, and 627,000 of those died. Those at highest risk are children and old people with weak immune systems. To fully understand the implications of the paper, we'll first have to look at an important amphibian pathogen. BD is a fungal pathogen targeting amphibians in the tropics. It likely originated in Asia. In the late 80s, the pathogen emerged in western Costa Rica. Over the next 20 years, it traveled in a wave through Costa Rica and Panama. During this time frame, the pathogen caused a catastrophic mass extinction of amphibian species in Central America. Estimates claim a decline of at least 500 species. 90 of those are confirmed extinct in the wild. A further 124 experienced a reduction of more than 90% in natural abundance. As already mentioned, amphibians serve as an important group in the food webs of tropical forests. Tadpoles feed on mosquito larvae in aquatic environments. One study claims that larval stage amphibians can eat up to 400 mosquito larvae a day. This leads to an up to 98% drop in larvae density. Additional to the direct predation, predator intimidation seems to have equally as great of an impact on mosquito density. The breakthrough study of Springborn et al. Now connects amphibian and human health. Data from 1986 until 2006 shows a direct correlation between BD-driven amphibian decline and malaria incidence in those regions. This cause and effect should now seem pretty clear. The amphibian decline driven by the BD pathogen leads to less mosquito larvae being eaten. As an effect of this, mosquito population numbers in those areas rise. This finally leads to a significant increase in malaria numbers. The implications of this paper therefore give a great example of eco-health. the declining health of ecosystems, in this case because of a pathogen targeting amphibians, directly leads to a decline in human health. But what can we learn of this? In 2013, a new pathogen was discovered by the name of B. salamandrivorans. It's a related pathogen to BD and also targets amphibian populations. Today, it's very important to try to control this pathogen as much as possible to prevent a similar catastrophe as caused by BD. This is important not only to preserve amphibian wildlife populations, but our own health. A wider importance of these kinds of papers are to show us how important and fragile natural ecosystems are. As Jonas Salk, the discoverer of the polio vaccine, famously put it, eventually we'll realize that if we destroy the ecosystem, we destroy ourselves.